longer this pandemic goes on, the more it's clear politics is playing a role in the response, especially in Alberta and Ontario. We'll get to Alberta in a moment, but first, a scathing assessment of the job Premier Doug Ford and his team have done in Ontario. The Auditor General says poor emergency preparedness, inadequate lab capacity, and a disorganized public health system meant Ontario was slower and more reactive to COVID-19 than other provinces. She blames a cumbersome command structure that's led by politicians instead of public health experts.
Deficient lab and public health information systems, a fragmented public health system, along with a health command structure not fully led by the chief medical officer or dominated by public health expertise, complicated Ontario's response to COVID-19.
Premier Doug Ford has always claimed he has listened to the experts, and today he is pushing back against that Auditor General's report. Mike Drolet has our top story tonight.
In the first few months of 2020, the world watched as COVID-19 spread from Asia to Europe. It was only a matter of time before North America would see its first case. But in a critical new report, Ontario's Auditor General says the province's top doctors consider the potential impact of COVID-19 to be low, which led to delays, conflicts, and confusion.
What we're saying is, in a time of crisis, the systems that people needed weren't in place. And we're showing what the consequences of that are.
The report says recommendations to improve the province's emergency preparedness were largely ignored, and Emergency Management Ontario was slow to react, in large part because of staffing. In fact, Ontario had one field officer for every 1.8 million residents, far less than BC and Alberta.
That's simply not the case. We acted very quickly. We were the first to register coronavirus as an infectious disease that had to be reported.
But who was calling the shots? The auditor noted that the large group tasked with overseeing the province's response was comprised entirely of bureaucrats and politicians. Chief Medical Officer of Health, Dr. David Williams, wasn't given a leadership role and only issued directives after consulting with the command team, an assertion that prompted a strong rebuke from Premier Doug Ford.
But to sit in the office and throw hand grenades at Dr. Williams and his team and the Minister of Health is totally unacceptable. Totally unacceptable. Stick with looking for value for money. Stick with the job that we hired you for.
Ford has led the daily provincial briefings, often with Dr. Williams standing in the wings, a fact not lost on emergency preparedness experts.
Scientific evidence and medical information is a critical part, but it's not the only part. That being said, it does send a very different message depending on who you choose to have as the face of that and who's responsible for what different elements of decision making.
The Ministry of Health was also singled out for its inability to adapt to the growing crisis, particularly when it came to testing and tracing. As recently as October, the auditor found it took as many as 4.5 days to begin managing a positive case, which coincides with the beginning of the second wave, a surge that shows no sign of leveling off. Mike Drolet, Global News, Toronto.
In Alberta, where COVID-19 has been spreading virtually unchecked, the Premier says civil liberties have to be protected. The province has now reached 500 deaths, and in the last 24 hours, there were over 1,200 new cases reported. Jason Kenney did declare a public health emergency yesterday, but then issued only modest restrictions. Indoor social gatherings are banned, but businesses, including retail and clothing stores, can stay open if they reduce capacity to 25%. Casino slot machines can stay open at reduced capacity, so can churches. And restaurants can offer in-person dining. Here's why Jason Kenney rejected tighter restrictions.
It would also be an unprecedented violation of fundamental, constitutionally protected rights and freedoms.
Kenney calls his approach balanced. Others have less charitable words to describe his leadership and say what he's doing will lead to more deaths, not fewer. Heather Urix-West explains.
Jordan Sorrenti's Calgary restaurant may be free to remain open to customers, but the dining room here at Patty's Barbecue and Brewery has been shut down.
We chose to close. We've been watching the rise in numbers, and it's been getting scary.
Sorrenti says as COVID-19 cases rose in Alberta, the number of people willing to visit his restaurant fell. It's why he says he was disappointed to hear the province wasn't doing more to bring the virus under control.
Obviously, it's quite clear that Jason Kenney was trying to strike a balance between a number of different, in fact, opposing positions amongst his MLAs in his cabinet and Albertans generally.
Today, Alberta's government is announcing...
Stressing the importance of protecting rights and freedoms, the Premier called the new restrictions announced Tuesday the minimum required to safeguard the health system. But there are questions around whether those minimum restrictions go far enough.
Quite frankly, when you look at a province like Alberta and the cases that they're having there, they really should be doing everything they can to not only stop the rise in cases, but they need to start to see a decline in cases.
The province's ICUs are already near capacity, and in a situation where every day counts, the province's biggest new restrictions, shutting down schools for grades 7 through 12, doesn't take effect until next week.
What's going to end up happening is we're going to end up in a prolonged, deeper lockdown than was necessary. We're going to have more deaths than were necessary, and I'm afraid this doesn't get a pass from our group.
Because of how the disease progresses, it takes about 10 days after infection before a patient might need hospital care. The fate of the next few weeks is already sealed, and hospitals are bracing for impact. But what's not known is what will happen next, and whether Jason Kenney's gamble on finding a balance will truly be enough to protect the province's health system for everyone. Heather Yurex West, Global News, Calgary.
The approach in Nova Scotia couldn't be more different from Alberta. 16 new COVID-19 cases were reported there today, and the Premier decided this week it is time to take tough action. As of midnight tonight, strict new limits are being imposed on people's lives, and the Premier has told Nova Scotians to stay the blazes home over Christmas. Ross Lord reports.
In the Maritimes, the second wave of COVID-19 has finally arrived, making it a struggle to ride out the pandemic safely. At this free rapid testing site, there are long lineups. Many are university students, part of the 18 to 35 age group where the virus is most common.
No, I have heard of people who go to Dal and live down the street from me testing positive. So it is within the Dalhousie community.
A sudden come down after Atlantic Canada's remarkable success against the virus. As COVID-19 swept across North America, one corner of the continent remained mostly unscathed, Atlantic Canada. Now that the second wave is spilling into this region, that remarkable distinction is in jeopardy.
The government order means there will be no in-person dining at restaurants or pubs for at least 2 weeks. Public gatherings will be limited to 5 people. And retail stores are being told to limit the number of shoppers and staff to 1/4 of their capacity.
The province is discouraging in-store shopping for Black Friday and even Christmas shopping in person.
We couldn't continue to operate with the employees and with the anxiety that they were feeling.
Joe McGuinness is isolating after a precautionary COVID-19 test. His Halifax pub is closed, hopefully for weeks, not months.
We were certainly the envy of North America. We can be there again with decisive action, and people need to follow the rules.
Easier said than done, it seems, 8 months after the pandemic started.
Is this sufficient action? I think it probably is. The fact that they are seemingly overreacting to what some people would perceive as a small number of cases, I think is a good sign.
More turbulence in an unsettling time. Ross Lord, Global News, Halifax.
British Columbia's COVID-19 numbers keep shattering records. Yesterday, almost 1,000 new cases were reported and 284 people were hospitalized with the virus. Among the public health orders, masks are now mandatory in all indoor public spaces. But as Robin Gill reports, tougher targeted restrictions might be needed in one region where numbers are spiking.
Burnaby General Hospital is in the heart of British Columbia's pandemic hotspot. The emergency room now closed because of an outbreak. The hospital is in a large and sprawling suburban area outside Vancouver, known as the Fraser Health Authority, and a majority of cases are here and multiplying. But infectious disease experts say this surge is consistent with a second wave of the virus.
As soon as we lose track, namely the contact tracing system gets overwhelmed by the number of cases in the community, then it's a larger problem. And if you look at Alberta or Ontario right now, they're having those challenges.
You have to keep your mask on.
The health crisis is getting resistance. At this grocery store in BC's southern interior, security had to be hired to ensure shoppers mask up.
Get out. I'm asking you to leave.
All right.
Scenes like this prompted the province to make masks mandatory in public places, with fines set at $230. And it could be more if customers are belligerent.
They do not have the right to endanger other people's health. It's time for this small minority to shut up, grow up, and mask up.
The province's top doctor caved into mandatory masks, but a week ago she was still reluctant.
Many of the settings that we are talking about are settings where people would not naturally wear a mask, like in your home or at a party.
Schools are still exempt from this recently implemented rule, even though the medical world has been asking schools be in on a mask mandate.
Well, I've always been a bigger fan of masks than Dr. Henry.
It's one level of defense against a virus that doesn't seem to be slowing down, at least in the most populated region of BC. Robin Gill, Global News, Burnaby.